So this is going to be a little bit of an update video for some of the Medicare 2026 changes. That's not every single change, but it's probably the big ones that you're going to encounter when you are using your Medicare plans in 2026. So there's three main categories. One, the Part B premium increase, which you've probably already seen. Two is the Part D deductible increase. And three is what's called plan exits. Many plans have made large plan exits, especially on the Medicare Advantage side. So the Part B increase and changes are going to be due to rising healthcare costs. That's why these changes really always tend to increase and not decrease. I don't know the last time you can say you saw a decrease in your healthcare costs or premiums. So the new Part B premium is 202.90. It's up about 10% from last year's 185. The Part B deductible, which is especially important if you have a Plan G or N Medicare supplement, is up to 283 from 257. And then in response to that, Social Security has given a cost of living adjustment of 2.8%, which will hopefully offset some of those costs. Depending on what your Social Security is, that might not offset the entire cost. But it is important to know you're going to get a raise with Social Security if you're on it. If you're not on it, then that may not help you, at least for this year or until you go on it. Second would be the Part D changes. So that's your RX plan, your prescription drug plan. And this is prescription drug plans that are part of Medicare Advantage plans, as well as standalone prescription plans you may have if you have a Medicare supplement. So the Part D deductible, max deductible, will go up to $615. Not every plan will go up to 615. Some will have zero deductibles. Some will have somewhere in between zero and 615. But just know that's the max that they could have. The annual out-of-pocket maximum for covered drugs goes to 2,100 from 2,000. So what that means is any drug that's on your formulary or the list of covered drugs on your plan would count against that 2,100. That's why it's so important to make sure the drugs are on your plan and covered, because if they're not, it will not count against that 2,100. You could pay a heck of a lot more than that, thousands more than that, if the drug is not covered. So you have to make sure it's on your formulary for whatever Part D plan you have. Now, they've also announced that Medicare is going to begin to negotiate some prices for some of the higher priced brand name prescription drugs. I have seen a little bit of that already start in 2026 with certain drugs. So just hope that some help might be on the way, but you want to plan for what the prices are now. And then if that happens, that will just be an added benefit. And then, as always, see if you qualify for some help. Extra Help is a federal program through Medicare, and then PAD is the New Jersey State Pharmaceutical Program. If you are in another state, most all states have a pharmaceutical program, and they're typically based on your income. If you fit below a certain income threshold, you'll qualify. So if you're curious to, if you qualify or not, reach out to me. I also assist people in doing the PAD application in New Jersey. It's relatively simple to do. But if you've never done it before, it could have some hangups. So reach out to me if you have questions on that. And then the last one are massive plan exits. So there's certain companies that have pulled most, if not all, of their plans out of certain areas within New Jersey. And this really affects Medicare Advantage. If you're on Medicare supplement, it's not really going to affect you there. But if your plan is canceled, you're not going to be moved typically into a different plan automatically. That you're going to have to do something in order to move into a new plan. So what would happen if you don't find a new plan? You would lose your coverage, and some of you may have already experienced that that you lost your coverage and you had to re-sign up and maybe have a gap. So you don't want to have that. You just got to make sure you are moving yourself into a new plan. And again, if you have questions on how to do that, reach out to me. I had a lot of people this year on plans that closed. We just do what we always do. We do a strategy session. We look at their drugs, their doctors, the hospitals they go to, their health needs, and we pick a new plan. That's why the enrollment periods exist. So just make sure you do a review if you're affected. So what are the next steps? You got to do a full plan review, whether it's you doing it or me helping you with it. Again, my services are free, so you don't ever pay me to do your plan reviews. The plans cost the same whether you come to me or you go by yourself. The compensation is built into these plans. You're already paying for a broker, whether you use one or not. So put all your drugs into the Part D plan finder. If you've been on Medicare.gov, you can put in all your drugs into there, as well as pick your pharmacies and whether you want to use mail order or a specific local pharmacy. And it'll estimate your drug costs, and you go with the plan that has the lowest drug plus premium costs. And then also make sure your Medicare Advantage plan is still available and active. Just make sure there's no surprises. The last thing I want to see with somebody on their health insurance is that they go to use it and it doesn't work, right? What is the point of insurance if you have it and you think it's going to cover you and it doesn't cover you? So if you wanted me to help you out, book a strategy session. That's my calendar. It's also going to be in the description below. Again, it costs nothing to use my services. You're never going to pay me directly. You're never going to hand me any money. The way it works with Medicare is all compensation is built into all the plans automatically. So whether you go sign up yourself and do all this work on your own, or whether you use me, who's helped hundreds and hundreds of clients to do this, you're going to pay the exact same amount. So my services essentially are free to you. I never ask you for any money. So if you book that strategy session, we could just make sure for this coming year that you're all set and you're not going to have any of those unneeded surprises.